And we are back. Upwardly Global is dedicated to breaking down employment barriers for low-income immigrant, refugee, and asylee professionals, fostering their integration into the U.S. economy. Now, since the year 2000, Upwardly Global has equipped unemployed or underemployed newcomers with essential skills, career coaching, and valuable social connections, helping them rebuild their lives and pursue successful careers. Joining me now, the president and CEO of Upwardly Mobile, Jina, Krause-Vilmar, and we thank you so much for joining us.
Hi, Darren. You did a great job pronouncing my
Did
name.
I get it right? 100% right?
It's really close. It's really close.
Okay, don't kill me. I'm glad to have you with us.
Same here.
When we talk about this, really honestly looking at the situation of immigrant and refugee professionals, we do have immigrants that come with skill sets, refugees that come with skill sets. But I know that part of what you're doing is really sharpening them and preparing them for life right here in the U.S.
Yeah, I don't think a lot of people realize that close to half of immigrants coming into the country today have a bachelor's degree or higher, and yet 1 out of 4 of them remain un or underemployed. These are people who are your rideshare driver, they're delivering your groceries. We've had individuals in the city of New York who have been homeless on the streets collecting recycling in order to earn 20 bucks a day in order to feed themselves. So these are the individuals we're talking about. And yet, at the same time, they're engineers, they're data analysts, they're doctors from their home country, and they're just unable to get back into their professions in the United States.
What are some of the barriers that we may not be so familiar with when it comes to that? Because as you talk, I think if you got a doctor, you've got people who've got great credentials, but they're just not from here. To assimilate and be able to get a job, somebody says, well, that could possibly happen, but we know that there's this time difference between the time a person looks for a job, actually lands a job. But I want to talk about that because you talk about the high level of credibility that a lot of candidates come with, and what are some of the barriers that we're seeing out there?
Well, so one of the biggest barriers is career navigation. So where do you plug into the market?
Right.
A lot of people do assume our community are plug and play. The same reaction that you have is like, well, this should be easy for them. But the reality is you can be educated and poor in the United States. And usually if you are, you're part of our community. So career navigation is one of the biggest barriers, which is what jobs do I qualify for? Am I competitive? Do I need to reskill or upskill? What job titles do I start with? Another one is professional networks. When you arrive, you're pretty much coming with nothing. And so you have to rebuild those professional networks, knowing that 85% of jobs are secured through an introduction. So that also means how do you understand the market? How do you make those relationships if you're actually living in communities that don't have access? And then the third is, English language. Actually, a lot of our people are English language proficient, but they're still nervous about using their English language in a professional environment. I cannot tell you what a stigma it feels like to have an accent and or to present in a way that is different from the way a US born individual would present. And then I would say the last biggest hurdle is we have a very specific way of approaching work. It's a US style. It has to be learned. It's not organic. We help our community understand that. But on the flip side, employers oftentimes lock this untapped talent out because they have a preference for made in America. They
Mm-hmm.
have a preference for people who have US degrees, US work experience. That's what they can understand and unpack. And so trying to unpack their skills using a skills first approach is a real challenge.
Yeah. I know you do a lot of advocacy, and talk to us a little bit about the advocacy movement and really raising your voice to create an awareness about this in a context that sometimes people aren't so familiar with.
Yeah, I mean, one of the biggest things is that our community exists and they're significant enough that we should be talking about them. 29% of the workforce today are immigrants. And so that trend is only going to increase over time. And what we find is that immigrants are not centered, whether it's in workforce, whether it's in community colleges, whether it's in the cities or states. And as a result, the kinds of service they are getting are really low level. So you're going into a job center and you're getting service that is a rapid attachment job, getting a job as a janitor. If you're lucky, maybe a course as a forklift driver, but not that sort of nuanced coaching support you need to understand, well, what does that actually mean if I'm a professional, if I'm a nurse, if I'm an IT professional? So that's one thing. Our people don't have access to service within the system,
Yeah.
and that's something we're advocating for. The second is that people understand that this community is here. They face barriers, and we need to address those barriers. So we're really excited that the Department of Labor just released a report. I'm talking 1 week new
Hmm.
that talks specifically about the barriers that this community faces and what the country, what the federal government needs to start thinking about in order to address those barriers. And then the last one is, listen, our people are in every occupation and industry you can think of. They're in regulated industries and they're in less regulated industries. Regulated industries are like law, physicians, engineering. Less regulated are HR, um, HR, marketing, things like that. So
Hmm.
if we're looking at regulated industries, and we know we have huge healthcare shortages, we have 2,000 internationally trained doctors who are sitting on the sidelines in the Bronx, right? During COVID, who could not even volunteer to help at hospitals because they were not considered eligible, right? That is a travesty. Not to mention, we've got healthcare shortages across the state. We've got healthcare shortages across the country. 99 million people live in an area where they cannot access a primary health care provider in their local area. And yet we have all this talent sitting on the sidelines, and we have limited imagination around how do we create a pathway for these individuals to enter back into their market, knowing that we want quality control, sure, but how do we eliminate those hurdles, that bureaucracy, reducing it from needing to spend 5 to 6 years to get back to being a doctor to you spending 2 years to get back into being a physician. So those are some of the advocacy that we work on.
Yeah, I'm bad journalist here because you talked about the government releasing their report and talk about barriers. So I'm not familiar with that, but can you give us a little bit of insight when we talk about the barriers that exist? Because I think you touched on two things that I want to talk about. One is the barriers that we're not familiar with, and number two is what are the ways to navigate? I think you gave, I'll come back to it in a second, but you gave an analogy of having 2,000 doctors that are right here that are available to go to work, but they can't go to work because of. So, what would be the best practice in terms of getting boots on the ground? And also, let's deal with the barriers. But so, barriers first.
Barriers first. So one of the barriers is English language, so professional English language. We need cities and states to be investing a lot more in English language support. We know that's like the number one barrier for people to be able to get better wage jobs, especially amongst the immigrant community. Actually, out of the 170,000 migrants who have been bussed into the city, almost 25% of them are college educated, right? So those who are coming from Venezuela in particular have college degrees. And yet language is one of the barriers that they face in terms of getting better paid jobs. So we have to invest more in English language. We have to invest in career navigation and licensing guidelines. Like states need to take some control over, if this is the talent we have, how do we reduce the steps they need to take, and how do we get them into their jobs quicker? But somebody has to navigate them towards that. And that has to be a coach, that has to be a navigator, or you need to have licensing guides that sort of help people understand, okay, this is step one, this is step two, this is step three. And that's hard because every state is different. So every state needs to take this on, and guidelines are constantly changing. So it needs to be constantly updated. But there's no centralized place where you can go to as an immigrant, whether you're in the country or you're in the state, to sort of say, okay, where do I start if I'm a nurse? And that information in and of itself would be transformative. And then there's one of the things we've been doing is how do we get people into work-based learning opportunities that are at the mid and the high skill level? So we have internship programs, we have apprenticeship programs. People are familiar with that, but that's really to get your foot in the door for an entry level job in a career. What do we do when you're returning into the market and you're needing to go to the mid and the high skill level? So one of the things we did in response to COVID was partner with New York Presbyterian Hospital, and we created a returnship program where at this stage we have 100 immigrant refugees and asylees who are working within the hospital system to support the hospital. And these are people who are working full-time jobs. They initially started for 6 months paying a full-time equivalent of, a full-time person's salary, and they were doing multiple things. Hospitals need people in multiple jobs. They need people who are in HR, who are in technology, who are on the hospital floor, who are, doing the data analytics. They need all of that. And so we've been able to place people that way and really allow the hospital to understand this talent. And I will say it is a learning curve. Not all employers get it. And so that's been a journey on both sides.
Yeah. Stereotypes, stigma, rhetoric, that can be a downfall for the work that you do. You talked about the states not too long ago. When you look at states such as Florida, you look at states, southern states, that aren't too accommodating to the immigrant population, the refugee population. How much of a setback is that for the work that you're doing?
It's a huge setback. I mean, work authorization is a real challenge. And I want to be clear. Anybody who lives in New York City, who's been on a subway, who sees migrants, usually women with their children, selling candy, the reason they're doing that is because they don't have the legal right to work. They have to wait 6 months after applying for their asylum case. They have to wait 6 months before they can even apply for work authorization. And then they have to wait another month, in theory, because the reality is there's a huge backlog. So what we see is people go a year without having the ability to work. And that's crazy because we have real labor shortages in this country, and we have people who need, as you say, boots on the ground doing the work. So I think that's a challenge. You've seen states, especially New York City in particular, really pushing the federal government to sort of say work authorization should be allowed quicker within 3 months. They shouldn't have to do a second process to apply. They should apply directly with their asylum case. And they've made some movement around refugees. And now they're making some movement, hopefully, with asylees. But the reality is a lot of people have to renew their work authorization after 2 years. This makes employers nervous. It makes employers nervous to hire talent where they don't understand their work authorization and their immigration status. And even though they're legally here, needing to constantly understand, do they have to renew? When do they have to renew? How long is it going to take for them to renew? We do have job seekers who lose their job because they can only apply for renewal of work authorization a month before the deadline, but it takes them 6 months to get it.
Right. And that's a huge barrier right there in itself.
Absolutely. And the ironic thing is USCIS is the institution that provides for visas and work authorization. But the reality is they just went digital. They did everything on paper. And so they just went digital like 1 or 2 months ago. So hopefully that's a good sign of like what we can expect in terms of speed, but it's also a scary sign in terms of how much further we got to go.
Yeah, and the word on the street was there is a backlog. I mean, since COVID, there has been a tremendous backlog already. So if you're new to the list, there's a chance that that increased wait time will be present for you. So a lot to contend with. Talk to me about the rewards of the work. I mean, obviously, seeing people be able to come to this country, to be able to find employment, to be able to find their footing, it's got to be, for you, also a great feeling.
It's an incredible feeling. It's also just an incredible story, right? Because immigrants are not only good for our economy, but they help us build resilient communities. They become homeowners. They engage in civic engagement and volunteer. They attend church. There's such a richness that, it's great to see when people are able to give back. The other thing that's really interesting is that, when somebody like me, hate to say it, when I do economically better, I move out of my neighborhood into a better neighborhood, a nicer neighborhood, a neighborhood with better security.
Right.
Immigrants don't. They stay in their neighborhoods and they reinvest in those neighborhoods. So they're really bringing up those communities. So it's great to see. It's great to see that people are hopeful. I mean, you cannot imagine the despair of knowing you worked tooth and nail to get a degree, a medical degree, and in some cases as women, you fought even harder for that. And then to come to the land of opportunity and to be told the best you're going to be as a janitor, that is such a devastating thing around your own identity and self-worth. And then to be able to say, actually, I can make it here, I can contribute and I can give back is huge. I'll just give you a quick story. We had a a colleague from Turkey. He was a refugee that came here. He had to leave because of democratic protests he was involved in, and he divorced his wife so that she wouldn't get in trouble. And he left her and his 1-year-old daughter in Istanbul. He came to the United States. He worked 6 days a week, 18 hours a day as a rideshare driver, delivering groceries, was barely able to make ends meet. And he got a job within 3 months of working with us as the lead data analyst at ADP. And he was able to bring his wife, his daughter. He likes to say he's the only man he knows that's married the same woman twice. And he's excited that the daughter's in daycare and childcare. And now he's trying to get his wife to become a data analyst because, that's what immigrants do. Once we make one pathway, we try to get everybody in that same pathway.
And Jin, as we talk a little bit about, advocacy and the work that's going on right now, really having somebody be acclimated to society really is huge. Having them come into the workforce, having a job, having that stability. Give us an inside look as to that process. We talked about somebody who's come and actually put a whole family, lost his family, got his family back. But that act of stability, talk to us about what that means in the life of the immigrant/refugee.
Yeah, so how we work with our community really is oftentimes they come to us, they need to be work authorized. We ensure that they have a certain level of English language to be competitive in the professional market. If they don't, we have partners around the city who also help us top up their English language so that they can get to that point. And then we look at what that career journey, like building out a career plan would look like. The reality is most of our people will need to work a transition job. It's a low wage job to get food on the table, to put a roof over their head. Oftentimes they don't have access to internet or devices, so they'll use the libraries in order to be able to do the job search and apply for jobs. And then we work with them to build up that career plan, not only it's okay to take that short-term immediate job you need, but to continue to invest at least 10 hours a day or 10 hours a week in that job search. And so then we work with them not only to help them meet other people in their industry, do mock interviews and speed networking events, but we also build out a career plan that helps them understand what jobs they would be eligible for and competitive for. We give them coaching on how do you design a marketable US style resume? How do you market yourself? How do you build a network? These are concepts that actually don't really translate across cultures and countries because they're not needed or expected. But in the US, the US style of storytelling is very critical. And so being able to do that well is important. And so we train them on that, and then we help them all the way through the interview and the salary negotiation. And what it looks like is on average, people come to us earning $5,000 a year, and they leave earning on average $65,000 a year in their jobs. Obviously, our retention rates are really high. So 1 year after retention, they're still in those jobs, 90% of them. And many of them, of course, go on to get promoted or to change to better jobs. And then they're also reinvesting in their communities and they're reinvesting in their families. We have a lot of people, for example, in IT, who will train people in their apartment complexes on, basic data science. We have community members who do taxes. That's their specialization, and they'll do free tax returns for low-income communities. And so I think the important part is there's a huge ripple effect when we get this right.
Yeah, and the give back, it's great to hear the give back that goes on, even with the skill set, and sometimes not even having the job yet. The give back is still present. So for somebody who wants to find out about how I can, be a part of Upwardly Mobile, what is the criteria for immigrants and refugees?
Yeah, so you have to be work authorized in the United States. You have to have been here for less than 7 years, because it is really hard actually to transfer somebody back into a professional workforce or back into their career if they've been out longer. You need to have a certain level, you need to be English language proficient, and you need to have had an associate's degree or higher, with at least 6 months of work experience in your home country. And that's all that you have to do in order to be eligible for our programs. We're also working with the city a couple of their job centers to train their coaches on also how to provide these services because, as I mentioned before, so many of the recent arrivals are mixed skilled. And so making sure that they're also able to get access to service.
Yeah. Are you satisfied with what you're seeing by way of workforce inclusion? Because we know it's still an uphill battle.
I mean, first of all, immigrants aren't on the map. We're not on the DEI map. We're not on the workforce map. If we are, only people consider us for low wage work. That's all we're really expected to do. We're expected to start from the bottom. We're expected to start from scratch. Everything we were before we came here is zero. And that continues to be the case. And our workforce is designed that way. And, these coaches, these job centers, they have an uphill battle. They don't have enough staff to provide the level of service that they want to provide. And so how are we helping them to be smarter? How are we getting technology in their hands that they can leverage? And then how are we allowing the coaches to be excellent?
And I want you to reiterate for our viewers, this is probably the most educated group that we are seeing in generations really come across to look for employment, to find employment here. The education rate is right there.
100%. I mean, there was a recent report that said, a majority of immigrants coming into the country now have at least a high school degree or higher, not to mention the 45% who have a bachelor's degree or higher. I think oftentimes we have a lot of assumptions. I mean, Mexicans who have come into the United States, 50% of them have a college degree. And so this is a very different demographic of people. Even when we're thinking about refugees, a lot of refugees today are also coming from middle income countries, countries like Syria, countries like Venezuela, countries like Ukraine. They have high education levels, they have robust markets. And so that is a mixed flow of people that we're seeing. And yet our systems are set up to assume that really people should start from scratch.
Yeah. So what do you predict seeing as we move towards the summer? Are we going to see an influx of people? Do you participate? I mean, do you or anticipate seeing an influx of people? How does the summer look for you?
I mean, most of the influx came from buses from the southern border, and I do think that's going to slow down because of the tightening of the border that's happened already, which in some ways is a shame. I will tell you, Darren, we get calls from states like Utah
Mm-hmm.
that or Ohio that say, "Hey, we know you guys have a ton of immigrants. If you guys can't handle them, can you send them our way?" Right? And how do we start creating relocation programs for states that do want them? And these are purple and red states. And so I think the big point here is the labor market is tight. People are starving for talent. But if we can't get this right in New York City, right? What
Right.
does that mean about us? I mean, we are the country's leader when it comes to immigrant inclusion and it comes to a diverse society. Like we can't turn away people and say, you can't come here. We have to say is we're going to build models to demonstrate that everybody can thrive and create shared prosperity. Because when we do, out of the 1,000 people we support back into jobs a year, they generate sort of $74 million in income spending. And so there's a huge ripple effect when we get it right.
Were you able to get any takers to go to Utah? I mean, obviously that's a little ways away, but I mean, how did that work out?
Well, the reality is we don't do relocation because we don't want to be accountable for how
Right.
they experience what they experience there. But Utah is very creative. They've already developed a pathway where they're able to now get Ukrainian refugees in Poland to come directly to the state of Utah if they can find them jobs there.
Wow.
So they haven't given up.
Yeah. Well, I mean, that's pretty innovative. So shout out to Utah for doing what they do. Before we go, I want to get a couple of things. First of all, for people who want more information, what do they do about going and getting connected with you?
Oh, we have a great website, upwardlyglobal.org. And you can find us there. You can apply for our program there. You can also volunteer there. You can also donate there. We have multiple ways people can engage.
And it is the first and longest serving national organization that's actually helping individuals restart their career and bring their skills and perspectives to the U.S. workforce. And so Jina's been talking to us for the last several minutes. And certainly before we go, you get the final word and anything you want to share.
I just want to share that, when we are diverse and inclusive, it creates prosperity for all of us. So we should look at this as a win-win.
Well, Jina, thank you so much for being with us. Appreciate having you, and certainly continue the great work that's going on. President and CEO of Upwardly Global. Thanks a lot.
Thanks, Darren.
All righty. We are going to take a quick break, but guess what? We got more coming up right after this.